In this video, we are going to review diabetes foot and ankle care, peripheral neuropathy screening, CMS measure 126. This is not a telehealth eligible measure. The definition of this measure is patients 18 years and older with a diagnosis of diabetes who have had a neurologic evaluation of their lower extremities within the 12-month reporting period. For the sake of this measure, the exam is done just annually, although clinically your patient may require more frequent evaluations. The workflow for this measure includes the following. If you're doing the examination in your office, under examination, you will select diabetes foot exam, and where these little blue S's are that stand for structured data, you're going to start by documenting the date of the evaluation. Then you'll go to the structured foot exam and document that you did all of the required sections of the diabetic foot exam. This includes monofilament testing, pedal pulses, visual evaluation, etc. You're going to close this and it'll automatically save your work, and you will see the results in the examination section. Over in the clinical quality worksheet, you will see that it has auto-populated that you did the evaluation on this date. Now, if the patient has had their complete neurologic evaluation done elsewhere, for instance at the podiatry office, you can answer in the clinical quality worksheet that the lower extremity neurological exam was performed by going in, clicking on it and putting in here yes, and saving your work. Then if you are in the patient documents, you can create a telephone encounter, and under a virtual visit, you can enter the results of the podiatry evaluation and the date that it was done. Or if you're in an examination, when you go into the examination, you can use the podiatric evaluation and just put the date of the exam that the podiatrist did it and that person's results, and maybe make a little note down here that it was done by podiatry. Once you've completed the examination and the date is in the chart, you're done for the year. So consider doing your diabetic foot exams on the first appointment that you see for your diabetic patients each year and be done for that calendar year. Now, there are exclusions for this measure. If the patient is not eligible for an examination, for instance, they have bilateral amputations, they have a mental status that precludes responding to the questions such as dementia, or they have documented peripheral neuropathy so severe that they have complete loss of protective sensation already, you can exclude the patient from this measure through the clinical quality worksheet by going into lower extremity neurologic exam performed and selecting patient is not an eligible candidate and saving your work. That concludes this MIPS measure. Thank you.